Don, stay with us. We want to bring in Betsy McCaughey. She is chairman of the Committee to Reduce Infection Deaths. Betsy has actually read the entire bill and has her own lists of winners and losers. First of all, on the question of how much this thing is going to cost, did you see a lot of hiding of numbers going on here?
Well, many of the programs in the Senate bill, newly created social programs, are not counted in the CBO scoring. That was made clear in the CBO letter to Harry Reid. So we don't have a totally accurate count on the cost of this bill. But when you were talking before about the reality of the Medicare cuts, I'm worried that they're all too real. Both the House bill and the Senate bill are largely paid for with approximately $500 billion cut in future Medicare funding.
But we have all been talking about the waste and fraud in Medicare for years. Isn't that the target of these cuts?
In fact, the cuts are largely made in the payments that will be made to hospitals, nursing homes, home care agencies, others who provide care to Medicare patients. And Richard Foster, the chief actuary of Medicare, warned in a report last week that these cuts are so severe that it may be that some of these institutions can't make a profit anymore and will actually back out of the Medicare program, reducing access to care. It will mean, what about seniors whose local hospital no longer takes Medicare?
But these cuts, whenever, as Don and I were talking about, whenever they've been proposed in the past, they never come through. Do you really suspect that this time they will stick, as bad as these cuts might be in your mind, that they will stick to the cuts?
I'm very concerned about the impact on seniors. Also, you've heard a lot this week about the U.S. Preventative Task Force and its proposals to reduce mammograms for women. You've heard the president say that no benefits for seniors will be reduced, but in this bill on page 1189, it says that preventive services for seniors can be reduced, and literally a half a page later, it increases preventative care, including diagnostic tests for people in Medicaid. So there's a real agenda here of shifting care away from seniors to other groups in society.
Don, I know that health care is not your specialty, but when you look at a new program, a government insurance program that is going to insure 31 million new entries into the market with a finite number of doctors and hospitals and nurses and healthcare providers, as an economist, don't you think that there's going to have to be some kind of rationing?
Well, I mean, so, classic supply and demand would tell you that if you increase the demand for healthcare services, you're going to see some pressure on the supply side. Probably prices go up and need more doctors. That's a point that the CMS actuary makes very nicely in his recent report. And yeah, you're going to see more competition for getting access to doctors.
So
let me make it clear.
But I just want to ask Betsy, who specifically is going to lose? What kind of patient out there is going to lose?
The big losers are seniors, right? The big
seniors, and not just the seniors who have Medicare Advantage.
Oh, absolutely not. The Medicare Advantage cuts are less than half of the total cuts in Medicare under both of these bills. The middle class, a single person earning $44,000, will be legally required to be enrolled in the qualified plan, the government-designed plan, but will not be eligible for a subsidy. The CBO scoring makes it clear that a family of four, for example, earning $96,000 pre-tax should be expected to pay 19% of their pre-tax income for premiums, copays, and deductibles. That's a big chunk out of a household income.
And Don, when you put together all of the expenses here as a final point, and you look at the deficit as it now is, a really worrisome deficit of over 10% of GDP. We haven't had that kind of deficit since World War II. How do you think we're going to pay for all this, particularly when the Chinese are beginning to balk a little about buying our treasuries?
Well, I mean, I think if you look at the bill, certainly the way we pay for it is in addition to the spending reductions we've talked about that may or may not happen, keep in mind there are also significant tax increases. Depending on which bill you look at, there are tax increases on high-income Americans, there are tax increases on
Don, I just got to ask you, I know you're a strict economist, but if we don't get the cuts that they've been talking about, and if the income doesn't come in from a lot of the tax receipts, and we do have a buildup of the deficit, how do we pay for it?
Then you got to go find either other spending cuts or other tax increases.
Or other people to buy the debt, and there don't seem to be a lot of those in the world.
We're not going to be able to run deficits like this indefinitely. Running high deficits is not going to be an option.
So what'll be the first balloon to pop?
Oh, that's a tough one. You know, I mean, I think we're going to see pressure on the tax side first. It's as a matter of just strict budget accounting, it's probably easier to do things that are going to raise taxes over the next 5 years than it will be to do things to bring in spending.
Don Marin, great to see you. Thank you very much. Betsy McCaughey, thank you for Saturday night as well as tonight. And